What is a workload? What is a workload for you as a nurse? Is a workload having too much to do and not enough time to complete all the tasks? Is it having too much to do and not enough equipment to facilitate you meeting your commitment to fulfilling your patient's needs? Is your workload not having enough staff to relieve you for a meal break? Is your workload an issue where at the end of a day, at the end of your rostered shift, that there's nobody to relieve you if, for example, in theatre your list hasn't finished, or in PACU if a lot of staff have gone off and only a few staff have come on and there are more patients in the department than can be serviced by a one-on-one or a one-on-two nursing care. That's 2 nurses to 1 patient, not 2 patients to 1 nurse, just to remember what our PACU ratios are. So what you have to decide is what a workload means to you, and to fill out a workload form is an insurance policy for you. If something was to go wrong on a shift and you weren't able to meet all your legal commitments to that patient or the other staff to meet your commitment under your registration, what the workload form is a document to alert and to highlight that some changes need to be made and some other tasks, other processes or policies may need to be implemented. And each time you fill out a workload form, it adds to the weight of your claim. So it's an insurance policy for you to highlight that there is an issue and something is wrong. It's also very important because a workload form under the BPF, the Business Planning Framework, is a Queensland Health QNMU initiative. It's a joint initiative. So this is a Queensland Health document that you are completing to highlight to Queensland Health that we have an issue and we need some changes to occur. So what Queensland Health can use those forms for is to increase the FTE, is to increase their stock levels, increase their equipment or upgrade their equipment or exchange their equipment. The Nursing Workload Form is your insurance policy, is your document for you to stand up for your rights and the rights of your patient. And because it is a Queensland Health document, there should be no fear of ever filling one out. It is the simplest form. Name a rough scenario or synopsis of what the issue is. Names of a few people who were also there. It doesn't have to be the other people. They can fill out their own forms. It doesn't matter how many forms you fill out. It can be 1 form for the whole day or for the whole shift, or every staff member on that day can fill out a workload form. There is no hard and fast rule. But if you do not stand up for your rights, who is going to stand up for your rights? I, in 34 years of nursing, have not yet met an employer who says, "You're so good, we're going to improve your award. We're going to give you more than you'd ever thought of." No, what nursing has been and nursing union has been is a fight for every single incremental step that we have achieved over the course of since the 1980s, since this particular QNMU has been formed. So fill out a nursing workload form for whatever your issue is. That is the take home for today. Fill out a nursing workload form if you believe that there is a workload issue. And a nurse's judgment is a vital part of that document, which cannot be eroded. And once you've put that into writing, your judgment, your clinical judgment, you have rock solidly locked yourself in to a standard of care that you are not going to deviate from. That is an amazing thing. Fill out a nursing workload form.